Well, I'm very pleased to actually sit down with Sangita Reddy. She's a joint managing director at Apollo Hospitals. Ms. Reddy, first of all, good afternoon and thank you for giving me your time. I know this is a terribly busy time for anyone in the medical fraternity at this point. I want to talk about some of the things that Apollo Hospitals is doing across the country. You have, from what I understand, arranged for a tie-up with OYO for 5,000 extra rooms. It's called Project Stay. Could you tell us what Project Stay is for?
So actually Project Stay I is stay isolated.
Okay.
So if you look at the statistics and the progression of this problem across the country, number one is that 80 to 85% of the people have no major medical problem. But they are a hazard to the environment and the community because when they move around, they then infect others.
Yes.
If 15% of the population, which potentially needs hospitalization, all come to us in a very short period of time, hospitals will be overwhelmed. And that's why they say we need to do everything we can to flatten the curve. We realize that many people, even if they want to stay isolated, do not have the home infrastructure or the capability to stay isolated. Whether these are travelers, people from out of town, or multiple people sharing a single room as their home and sharing a common bathroom. So whether it's students who are PGs, working professionals who have come in. And therefore we said it's important to create this isolation, to be able to supervise so that when this person moves from, so an X number of people move from a bad sore throat to the fever, from the fever to breathlessness and lung infection. So it's important during this period of time to be able to move them to the right facility. So isolate so you contain, move at the right time so that they're treated appropriately. These were the two intents of creating Project Stay I.
Well, I also understand that your that Project Stay I is being funded by SBI. You've done some very interesting tie-up. Could you tell us how you engineered these tie-ups?
There's no real engineering, so to speak. It's a matter of request and say that this is what the country needs. We're trying to do it. People may not be able to afford the rooms. So, I mean, say OYO, for example, it's a 700 rupees plus the cost of food. The medical supervision Apollo Hospitals is not charging for. We've put a technology telemedicine layer so that we can monitor the patients, but we're not charging for it. But the cost of the rooms and the food is there. So if someone can't afford it, we requested HUL, and I mean, Sanjeev has been fantastic, SBI, and then Sanjeev brought on Deutsche Bank and others. So we have a certain corpus of money to fund people who cannot afford the stay, to go ahead and be able to say, don't worry about the money, just come in and protect the community by keeping yourself isolated.
Ms. Reddy, obviously for someone who runs hospitals at this point, you did mention that hospitals need to be ready for what's coming. How is the staff at Apollo Hospitals prepared right now?
So first, let me say that our staff are amazing. Our team is outstanding. The Apollo family, I mean, I just cannot thank them or love them as much as they deserve. So number one is the fact that, they all sprung into action. A lot of training and guidance and, protocols. At every place, we had a simple policy in that once we understood the infectiveness of this virus, we said we cannot bring them into the main hospitals. We have to create separate isolated facilities. This was also the recommendation that we gave to the government, FICCI gave to the government, Dr. Shetty gave to the government, saying that otherwise you'll have a bigger pandemic on your hands. So we created isolated facilities, either separate buildings, separate access, wherever possible, negative pressure rooms, intensive care. Then we called the teams forward and did the training. Then we staffed at the back end saying that we have to make sure these people are not overworked. So we keep double the number of people. And those in the first line of duty stay within the campus in separate rooms so that they're not going home and infecting their family members, and they are protected from the spread as well. Then we made sure that they were adequately equipped in terms of, the PPE, the N95 mask, etc. And then, train, motivate, treat. Train, motivate, treat. It's a continuous cycle.
I also want to ask you this. So there's been a lot of talk about the PPEs. We know that in the US, for example, healthcare workers, on the front lines are falling short of the equipment. Uh, is is there enough in India? Can the civil society do anything to help at this point? Do we have enough equipment?
So, I mean, clearly, if you tell me today, do you have enough equipment? For today's cases, yes, we have enough. I don't think there's any healthcare environment which is being compromised today. If the progression goes at the current level, which is, I mean, approximately we're seeing a growth of 1.16, something like that, I think the government is preparing for that. So there are high-level committees, there are people moving in, and civil society in many ways. I've been on the committees where, manufacturers of other, say, auto components are looking at how can they help. First, they tried to create a ventilator. Then when we said, look, it's a little complex, they said, let's use our supply capabilities or our manufacturing capabilities to upgrade what is already being done. On the production of PPE side, I mean, people like Arvind Mills, we've been talking to them a lot, small people trying to stitch in their environments, everybody's swinging into the act. It's only a matter of coordination and working together. But, I think that it's been a tremendous, great response stories from every part of the country.
What can people who are at home right now feeling helpless, their inability to help, what can they do?
Faye, I think one of the important things that people can do while they stay at home is also definitely trust that the government and the private sector are all doing a lot to ensure, and India is fairly prepared. So first, don't worry. Second is that the virus is not such a bad virus, and even those who test positive, most of them are going to be completely fine. So stay strong, stay confident. But if you need help or need a number, don't hesitate to reach out. So the Apollo COVID helpline, which helps you access whether it's a fever clinic or testing, or you want the ICU, or just a teleconsult with your doctor because your mother's a diabetic patient, or you need to order medicine. So the COVID helpline from Apollo is 1-860-500-1066. The other project which I told you about, which is Stay I, because if you know someone who potentially needs isolation, who's not able to do appropriate isolation, that number is 1-860-500-0202. So both these numbers are important numbers. Please do save them and spread the word to anybody who needs help.
All right, Ms. Reddy, thank you so much for the work that Apollo is doing right now at the front lines of India's battle against COVID-19. Thank you.
Thank you, Faye, and all the best to all of you. Stay safe.